Hey everyone. Here's another story. We like to feature these every now and then because it really just hits home on the reason why you want to invest and have a lot of passive income, especially as you get up in age. So, this is from Yahoo Finance. What Medicare doesn't pay for becomes hefty debt for millions of seniors. Really depressing article, to be honest with you. But when you go through, they talk about this woman, Connie Morton's husband. The part that really caught me was that she says down here, we paid what we could. For the last 9 years of his life, he could no longer work. That's pretty sad when you think about it. Is they don't really even tell what age he died, but the fact that I guess they were expecting him to work all the way until he died, or the last 9 years of his life. I'm hoping to have the last 20 years of my life I'm not working. But that's just kind of an interesting quote to say the last 9 years of his life he wasn't able to work. On average, 65-year-old who left workforce last year may need 165,000 in savings to cover out-of-pocket health care. So again, let that sink in. You have your 401k balance, your IRAs, maybe money from rental properties. They're telling you that a 65-year-old, you may need, on top of just your living expenses, 165,000 for medical expenses, whatever that may be, that you have to go to the doctor for. The combination of medical bills not covered by Medicare for the retired couple, roughly 90,000. These figures are just staggering when you think about how much you need just to live, to pay your mortgage, pay your rent, put gas in your car. Not even talking about some of the debt that you could accrue with some of these healthcare costs. Contributors to healthcare debt for those age 65 and older. Lab fees or diagnostic tests are the highest. Dental care. Again, take good care of your teeth because it only gets more and more expensive the older you get. Doctor's visits. Then they talk about credit card debt. Obviously, you're going to the doctor and you start putting these things on credit cards with 20% interest. It just gets bad really fast. There was one other thing in here. They talk about assisted living facilities. The average rate right now is 74,000, 148 a year in 2024. As costs go up, as residents age and need more care, units for dementia patients can run more than $94,000 a year. And then this last part here, about 80% of those ages 65 and over will require some long-term care. 80%. So a lot of us will be, that's 8 in 10 people will require some form of long-term care, with nearly 20% requiring high-intensity care for more than 3 years. So again, the reason why we cover what we do and we try to tell you about building passive income, that's the kind of income you want where you literally can be in your bed and money is coming into the household, right? You could be in your bed, that could be in your own bed or the hospital bed, but at least money is coming into the household. And that's really how you have to think about your life and your future plans because no one's coming to save you and things are just becoming more and more expensive.